Hi, this is Peyton and Rachel with Sunday Remedy.
We're excited to have you guys, and we're excited to introduce Dr. Bryan Pries, who is here with us. He is a chiropractor here in the Charlotte area.
Yes, thank you so much for having me on the show. It is great to be here. In between cracking backs, it's good to answer some questions every once in a while as well.
Perfect. Well, I guess first, can you tell us a little bit about your background and where you work, your practice here in Charlotte, a little bit about that?
Yeah, that sounds great. So I practice on the east side of Charlotte. I actually just purchased a practice from a retiring doctor, and I've merged my existing practice into that one. So I consider myself a holistic chiropractor. So what does that mean? Chiropractors in school, we learn to really dive to the root cause of things. So that means going upstream, which logically makes sense, but in our current season and environment of healthcare, it's not being done. We're just like treating things downstream. So the best analogy I like to use is if you see that the water is red and it's supposed to be like blue, well, you're not just going to grab some blue dye and dye it blue again. You're going to see where is the red dye flowing from. Maybe go up the river a little bit to find the contamination. That's what we should be doing in the body. But with modern medicine, unfortunately, we're doing it the wrong way. We're just focusing on fixing symptoms. So chiropractic, in the principle, it talks about going to the root cause, and that has been the foundation of it ever since the beginning of the chiropractic profession. And chiropractors are really equipped in thinking this way. And many of us have expanded out of the spine because we're trained to, and looking at other things like organ systems, neurological systems, and how these things are being afflicted in modern health. We're fulfilling a gap that really isn't filled in other ways because it's one thing to go to the doctor and say, hey, you're healthy. And then all of a sudden people are dying of heart attacks a week later. But there is a gap of there's optimal, and then there's functional, and then you're just surviving. So when you talk about that spectrum, so in my practice, I try and address that. Of course, I'll see people for neck pain, back pain, headaches, but also fatigue, autoimmune disorders, sleep issues, skin dysfunctions, anything you can imagine under the sun. There's usually a conservative way to treat it holistically and more than just the adjustment. And we'll get into more of that.
That's amazing. Wow. Well, I'm really excited that you mentioned the difference between functional, optimal, and what is very common. There's such a difference between what's common and then what you should be functioning at.
Yeah, I think it's really important to have something like this in today's healthcare culture, especially like we treat a lot of sick care. We don't have a whole lot of preventative that people gravitate towards. So it's great to have something that people can utilize now that can, be preventative down the line.
Absolutely. And it's fulfilling such a void because right now, only 31% of people trust their primary care doctor. And that is really troubling because that is,
I also do not trust my primary care doctor.
And now a lot of people aren't even going. If I say, when's the last time you saw your primary, had some labs done, they're not even going. Well, I can order labs for people, and this is it's easy. They already trust me. People trust me. And then if I can send them just to check on things, then at least they know if they need to go further down into allopathic medicine or if something we can do naturally to help them.
Yeah. Absolutely. Well, okay. So I think this is actually the perfect moment to ask you this question. What are some common misconceptions about chiropractic care that you'd like to just address right off the bat for anyone kind of a little bit chiropractic skeptic? What are the things, like, I know some of the common ones are like, it's too expensive, it's not safe. Any elderly person will like look at me straight up and say, I'm going to be paralyzed. Those types of things. So once you start, you can't stop, those guys.
Yeah, all sorts of rumors like that. I hear this stuff all the time. And these are usually things I try and address with people right away in their first meeting with me. And one thing to address is that chiropractic is such a broad profession. Like, for example, I'll order lab work for some of my patients, but there's some chiropractors who don't even want to touch that. Some chiropractors only adjust one joint of the entire spine. Other chiropractors are doing muscle work, whereas others would never, ever touch a muscle. And it's very broad. So to say, I tried chiropractic or my friend tried chiropractic and it didn't work for them, well, that's not giving it a fair chance because there's a million different techniques and different schools of thought. So you have to really think about what technique didn't work for you or that chiropractor didn't work for you, right? As for the safety, the malpractice insurance should be a good indicator of how safe chiropractic is. I mean, my malpractice policy is so cheap for me to carry. It's more dangerous for us to be driving a car than it is for me to be adjusting the spine. So they've done countless research studies. I mean, aspirin alone or Tylenol, NSAIDs in general have killed, so many people every single year. And that's usually the go-to for back pain. Whereas the rate of that for chiropractic is zero.
That's an excellent point.
Yep. When you hear about stroke or paralysis, things like that, that's going to be from the chiropractor who maybe didn't do a good enough exam or any exam for that matter, and just really didn't listen to the patient of the reason that they were coming in. That's where you'll miss things. And that's like extremely, extremely rare. I mean, 1 in a billion perhaps. And usually if someone is coming in with something really scary, that's like a red flag, you should be able to catch that as the doctor. But sometimes doctors aren't paying attention. So
I have a question, and this is just like my experience. I believe that most chiropractic visits are not covered under insurance unless you have like a valid medical reason, like where your provider sends you. Is that correct? And is chiropractic covered under insurance? And if not, why?
Yeah. So insurance, they love to be able to make sure they're keeping you alive, but they don't care if you thrive. That's what I always say. So they will cover an active treatment complaint, most insurance companies. So that means like, oh, I threw up my back, or this chronic back thing is irritated all of a sudden, and they'll treat you for more aggressive treatment over a short period of time. But then when it comes to maintenance care, they stay out of that just for the cost purposes of that, essentially. So oftentimes it is an investment out of your own pocket, but it has to be looked at that way. It's just, where do you want to put your money and your finances? It's like almost like the gym membership. Like, do I have to pay for this, or do I get to pay for this because I feel so much better and I'll live more abundantly? And they found that with chiropractic care, you're far less likely to get injured, fewer sick days, fewer work injuries. So you end up being more productive in your workplace. You end up making more money. People who focus on self-care are making more money out there. So it really pays for itself, as you know.
Yeah, it's an investment, if you will. It's an investment in your health long term. So it's kind of like, maybe make the investment today, and then it'll pay off in 50 years when you're not 20 years, 10 years, 5 years, depending on your age. For me, I'm hoping for 50, but
there we go.
I think like with my experience when I went, I had an injury from the gym, and my tendon was just like flared up. So just getting an adjustment and getting scraping and cupping done, it wasn't covered by insurance. However, I know that if I went and sought another doctor through my insurance, I would have paid the same amount or more out of pocket. So I think that's like kind of a good way to look at it too. Although you may think that, oh, well, my insurance covers this and that's cheaper. Like a lot of times you still have co-pays, things aren't covered. They'll send you to PT, which isn't necessarily always covered depending on your insurance. So I think it's a good way to look at it, is although, you're paying for it, it's quite the investment versus an alternative.
Yeah. And it's not crazy expensive, usually. And usually most offices are able to work with people. At my office, we're always able to work with people on that front.
Yeah, that's awesome. So I think we need to jump back a little bit and have you share your story about when you were a teenager and what kind of got you introduced to chiropractic care and kind of what inspired you to take this route as a career.
Nice. You ever seen people water skiing, right? And they do water ski shows. I don't know if you've ever been to one or seen one on TV. So the people do the big pyramids where they're stacking on each other's shoulders while water skiing behind a boat. Well, back home in Wisconsin, that is a huge thing. It's the water ski capital of the world, water ski show capital of the world. So I, of course, was on one of these teams in middle school and high school. And once you're the big, strong football player, they decide they're gonna put you at the base of that pyramid with all this weight on top of you. Well, I think it was just because I had a very newly developing spine. I was still growing, all of these things. having that much weight on me really caused a lot of issues. And I started having back pain. And this led me down my own journey where I went to see my primary care doctor. I tried different medications. I tried massage therapy. I tried different physical therapists. We tried the insurance one, the out of pocket one. And, we tried all sorts of different things and nothing was working. So finally, someone referred me to a chiropractor and I was like, wow, this guy listened to me. And this is the first time I've had this much relief in forever. So that got me hooked. And then after shadowing more and more chiropractors, I learned just how broad of a profession this is and that you can do much like with nutrition, with supplements, ordering labs, all of this stuff. I thought, wow, this is a good, dynamic, holistic profession. And that really caught my attention. So I dove all in.
That's amazing that you had that exposure at such a young age to experience the difference between a quality doctor and someone who actually heard you and someone who didn't.
Yeah.
That's
Yeah.
incredible, especially with the nutrition and lifestyle component. Then even, I think this is becoming more common, but I feel like this was more rare.
Yeah, absolutely.
Treatment plan.
Yeah, it's usually we get to the injury part or we get to the sick part and then you go to the doctor. It's rarely that we put, we take a step back and do the preventative care. So I think that's incredible that you got to experience that. You got to experience the supplements and like what that looks like, because traditionally when you go to, your annual physical or you step foot into a doctor's office, you will never hear them talk about nutrition. You will never hear them talk about supplements that you can use, anything that, doesn't bring you back into that office or benefit them in some way. They just, you don't get introduced to that.
Yeah, definitely. Unfortunately.
So what advice would you give to a prospective patient looking at getting chiropractic care, but they're feeling a little hesitant? Also, when they're sitting in the office with you, I know that sometimes it's very customary for patients to conceal or not share the full extent of their symptoms, what they're experiencing, especially for someone who may not have previously considered themselves as a whole entity. They're just looking at the presentation of a symptom. What advice would you give to that person?
Well, first of all, to find a good chiropractor, it always has to be word of mouth, like with other things. You ask around, you ask your friends on Facebook, whatever, searching for recommendations. Word of mouth really is going to be the best. It's hard to find the best chiropractor on Google because, you can automate reviews, and often any business that has like the most reviews, I'm really suspicious of why they have so many sometimes, I want you to think about chiropractors being a partner in your health and part of your team, a healthcare team. We should all have a team. For example, if I really strain like one of my shoulder muscles when I'm working on patients in the day, then I know there's a body worker, massage therapist that I will go to that's going to get it worked out, right? And we all need to kind of like through our lives establish a team. If you're ever going through something mentally, you should have a mental health therapist, someone that you can talk to and work with, for example, through a very stressful period to help you through that. And chiropractors are part of your team. And if you find someone who's dynamic and operates in more of a holistic fashion, who can really educate you, some people come to me and they'll say, "Oh, I'll press on a spot." I'm like, "Gosh, that's really tender. Are you having any heartburn, for example?" And they're like, "Yeah, I take medication for that every single day, but I didn't think it was a chiropractic thing." Well, yeah, it's definitely a chiropractic thing because I'm a doctor and I'm going to look at things differently. So all of the way that your nerves flow is a two-way street. So I like the analogy of if there's a traffic jam on 77, for example, if the far right lane is blocked, then guess what? The rest of those lanes are going to be really slow and blocked as well. And traffic on the opposing side usually slows down too, right? So if there's a nerve that's going to a muscle of your low back, but it's also going to your lower colon, for example, then if you're having distress in the colon, it can actually affect the low back. So it's called the viscerosomatic system, and it's very real. And I always say that the internal affects the external. So if there's something inflaming what's going on inside, you'll experience it outside, and it's going to slow down your healing on the outside too. So chiropractors are often able to look a little bit deeper at some of these things that people are looking to get managed in a more natural manner. So basically, if you don't want to take medication for something, usually there's a good holistic option.
What are some of the parallels? So, for example, like you're able to identify based on a specific piece that someone has heartburn or someone may have an issue with their colon. What are some of the more interesting like parallels? Like, where would you look to see something like that?
Yeah, so there's different areas of tenderness. If you ever look at like a graph of acupuncture points, for example, there's something called Chapman's reflexes, which are actually points around the body that are associated with different organ systems. So certain spots you can press, and if there's tenderness there, then that's a hint of a issue with the underlying organ, for example, like just over the liver or the gallbladder. The gallbladder is really a tender area in a lot of people, and that's just on the right side, just below the ribs. And I mean, when that's tender, it's like, okay, you're probably not digesting fats very easily, getting these vitamins A, D, E, and K, which are fat soluble vitamins. And it's like, okay, have you had your vitamin D tested? So it kind of opens up that pathway there, and then send them for a lab test or explore some other symptoms. And usually it can find some organ dysfunction in people that way too.
That's amazing.
I like that you guys have the ability to do the lab work. I think it's, I just got a whole panel done just to like test and see like what you're low on. But I think it's nice for the preventative care, right? Like, speaking of how preventative it is, you're able to just track all of these and catch things before things actually start to go wrong, which you can see when you're low on a certain mineral or whatever it is, or biomarker. I like that you're kind of able to pinpoint. So I love that you guys are initiating that and helping patients commit to that.
Yeah, and I believe that chiropractors are going to be on the forefront of that in this new season, of where people are really wanting to take control of their health. And we can't, yeah. So it is the time for that. And people are looking for someone to partner with. So I think that it's a great opportunity for chiropractors to step into that role, and chiropractors and naturopaths as well. It's a great, great time for them to step up and fulfill that.
I know we have like a lot of listeners that probably have the instant gratification, so this is directed towards them. But what are the short-term results that typically patients see when they go get adjusted?
Yeah, sometimes when people come to me, if you imagine you have a stuffy nose, you just feel like just bound up and congested. It's like, oh, make this go away. That is how a lot of people come to me feeling. And they're like, I just feel bound up and I just need to be like opened up, get something released. And then the moment that they get adjusted, they'll feel taller. They'll feel like their range of motion is better. They're actually stronger. If we tested them in the gym, they're going to have better range of motion. So if they go golfing, their golf swing will actually be more fluid and they'll be able to hit the ball farther.
This.
Yeah, they love that. I had a guy recently who went golfing with his dad, like right after getting adjusted. And he was like, dude, I destroyed my dad for the first time in golf. And it was it was amazing. So,
So what are some long-term, I know that you said them a little earlier, but I want to lean into that to kind of just reiterate, but what are the long-term benefits of getting adjusted?
Long term, this enhances the body-brain connection. So if you want to talk about being more self-aware, it actually makes the computer system up here more aware of everything going on below. So that means more aware of your organs, of all of the muscles, of all of your joint positions. So that's the biggest effect. Long term, it's going to help prevent some of that postural stuff, that it's not like we see anyone like this nowadays, right? So the head starts to go forward.
Not at all on their phone or their
right?
desk or...
Exactly. That it's going to be preventative against arthritis and degeneration of the spine. You're less likely to get sick, less likely to be injured in general. Those are just some of the long-term big benefits.
I mean, that's amazing. I think even like quite a few of those we talk about, right? Like the better quality sleep.
Oh yeah, that's huge.
And just like being able to like prevent injuries. That's so important.
It's also fascinating. I've actually never heard of a chiropractor who also ran blood work, did labs. That's kind of a new phenomenon for me.
Yeah.
I did see a chiropractor while I was living here in Charlotte because I was very, bunched up. It felt like I was sitting very poorly, working from home, and arguably probably not a great desk chair either. But I was sitting, my posture was terrible. so on and so forth. And so I kind of felt my hips were clicking when I would walk, and I could hear it sometimes. And I did a lot of hiking and stuff. And so when I went in, they actually like had me like lay on the table, and they could see that my legs were almost like slightly, like my one leg was actually shorter than the other because of how I sat in my chairs when they did my scan.
Wow.
You know, all the things. But that was also around the time that I went to go see a naturopath, where they actually ran the full blood work panel. But it is amazing that you're able to do that in one shop at your practice, because you know, for like an update, like I would love updated blood work, but
Yeah.
I don't necessarily want to go and do the whole thing that I did the last time, because I learned so much the last time. I feel like I'm very capable of doing some of it myself, but at the same time, having someone like look at it, I know there's things wrong with me.
Yeah, I like that it's an all-in-one, makes it a little more attainable for people.
That's amazing.
And you know, I'd say one of the best side effects of chiropractic is actually the stress reduction that we get. And there's a radical stress reduction where it takes your body from that sympathetic fight or flight response to the parasympathetic, which is rest and digest. So, I mean, there's people that have been getting chiropractic since they were kids, and now they're 70 years old, and they swear by it. They say it keeps them healthy, keeps them agile and
low
moving.
Cortisol.
Right?
Talk about the low cortisol levels all the time.
Yep.
Nice. Amazing.
Have you seen, so there was like this image that was like surfacing the internet, but it basically was like what people are going to look like in 20 to 30 years, because everyone's working from home and being on their phone, and like it's like just this person's spine that's like super slouched and has like, you know, the bad neck and everything. What do you think do you think that this is like an accurate prediction of people, like, you know, in the chiropractic industry, that you're going to start to see a change because people are working from home, because people are on their phones so much?
Yeah, and it's really interesting because I see a lot of young patients, in particular young females for some reason. They're at that like 14 years old, and they just really have that forward head posture. And if we ever took an x-ray of their spine, you would see that you should have this nice, beautiful reverse C-shaped curve of the spine, and it's just completely gone. The head is just forward, and that's very problematic because the nerves there contribute to that sympathetic nervous system. That is what's activating that stress response. And the more pressure you put on them, the more stressed out you're going to be. So I can already tell that that girl is going to have health problems much down the road because she's not able to really get into relaxation, and the spine is already in a very bad place. So I can already see that happening. It is really frightening. Like, just
That is amazing. I mean, the amount of people, the amount of times, and I think we're both guilty of this at times too, is the amount of time you spend on your phone. It's very much like put that thing away, put it on the other side of the room, turn it on do not disturb, and just have some time where you're actually looking at people. Like, I don't know, simple thing. This morning I went to the dentist and I walked from point A to point B, and I left my phone in a different room. And it's when you don't walk with it, I notice, like, especially in a public place. At home, I leave it, God knows where, I never know where my phone is. But when you're like walking from point A to point B, and even like a doctor's office, the small talk, you look at someone face to face, you're required to do that because it's common.
Yeah.
You don't have a little out on your phone. And it's not like I do that all of the time, but I do see a lot of kids do that. Like a lot of younger kids do that.
Yeah, exactly.
You're losing like the personability of talking to someone.
And this was like something that was on Keeping Up with the Kardashians, but she had this, I can't believe I'm bringing this up, but you know.
I can't believe you are either.
This is in the name of science. So in the name of science, Kim said that she had tendinitis because she was taking too many selfies. So like this is her phone, and you know, because she took so many selfies, she had to hire someone to take them for her while her wrist was healing. But she said this was like a legitimate thing. You know, it was on TV, so who knows? But she said because, you know, taking so many selfies, it was bending her wrist. And so I wonder if, like, you know, this can contribute, like people holding their phone like this, taking videos. Like, I mean, that probably I would assume it's probably just like
I
not.
hope no one is taking as many videos as Kim Kardashian.
But, and, you know,
yeah. I could totally see it happen. I'm sure it's real. The tendinitis is real. Yeah.
I hope no one is doing that. I'm going to be real. All right. So I think, you know, we can pivot off of Kim a little bit and guide into, do you have any favorite success stories where you saw the most dramatic improvement or just long-term we had a patient that was really invested in the whole thing and you got to kind of see it start to finish? Like, would you have any favorites?
Yeah, so I would say from a chiropractic perspective, one of my favorite, well, the best case would be like a baby that I saw that the parents were struggling so hard for 5 months. This child would not sleep through the night. They would only sleep on their chest. So they were extremely sleep deprived. They had to like be propped up in bed to help this baby sleep. And when you adjust a baby, it's not like you're whipping their neck to the side and snap, crackle, pop. It's very gentle, almost like fingertip pressure on the right spot. So I did one adjustment into two different areas of the spine, and they came back the next time. They looked so different. They just looked well rested. I was like, oh, this is a good one. And they told me, like, you're not going to believe it. She's sleeping in the crib. We're good. Everything is good now. So that's one of my favorite ones because it was a radical change just in one visit. And I mean, there's been a lot of stories like that where people come with, some of the weirdest pain in different areas, and I'm like, oh, that's just a rib fixation, and we need to like adjust that, and it just radically solves it. From a nutrition side of things, my most rewarding case would be a couple years ago. I decided to start taking on like harder, more challenging cases, and there was one patient with Crohn's disease that came to me, which is an incurable, I put that in quotes, incurable autoimmune disease. And he went to Thanksgiving with his family. Gosh, yeah, that would be a year ago now. He went to Thanksgiving with his family, or maybe 2 years. He went to Thanksgiving with his family, and they were like, "Oh my goodness, you were just looking so bad." He was losing a lot of weight. He was going to the bathroom like 30 times a day, and it was just horrible. Just depleted, fatigued, looked really unhealthy, frankly. And I thought, "Oh my gosh, I really got to help this person." So I evaluated him and did some testing, and what I found was that we needed to just like strengthen some of the immune barriers of his gut and put him on some supplements. And within just 3 months, he had a radical reversal of the Crohn's disease to the point where it's like completely in remission, and it has been ever since then. So that's been the most rewarding because now any Crohn's patient that comes to me, I'm like, yes, we can do this. Let's get this under control. Your incurable autoimmune disease, like, let's get your life back. So
It's
I
huge
love
impact.
those. I love those stories so much. But I love the baby. Okay, so talk to me about pediatric chiropractic care, particularly. Like, do you work on infants? What do you usually see with babies?
yeah, once you have a baby yourself, you kind of become qualified to work on babies because you tend to work on them and like hold them constantly. So my daughter is 2.5 years old. And of course, I worked on my wife throughout her pregnancy because there's a unique back pain that happens when you're carrying a baby and your whole body changes. And then since my daughter was born, I have assessed her and worked on her just because I know the benefits. And again, it's very light chiropractic care, but it can be really effective at it helps with sleep, digestion, colicky babies, GI stuff, constipation. These are all reasons that parents bring their babies in. Ear infections as well can just knock that out really easily. So, family practice.
Love
So
that.
you like, I guess in terms of chiropractic, it's benefits babies, people. Like, what age do you suggest people go? So like, even infants, let's say if someone hasn't gone, in their life, like they didn't have the benefit of going when they were a child, like what do you think is a good age to really start leaning into that?
It's never too late. I see people from womb to tomb, truly. The oldest person I've ever adjusted was like 98 years old now. So, and I'm not cracking her bones either because we might get some bad cracks out of those. But there's different tools to use. You don't even have to do hands on adjusting. So, when people are ready to commit to going to a higher level of health, whether they're in pain or not, it's going to benefit you just because of the effects it has on your nervous system and relieving stress. And people feel better getting adjusted. It's healthcare. It helps you.
That's amazing. And then, do you have any simple practices that maybe people watching could incorporate into their daily routines, particularly probably posture centered or something, to support their spinal health? Because as we're talking about, you're on your phone all the time, different things like that. So, what are some practical tips?
Absolutely. So I'm a big fan of postural breaks on a very frequent basis. This would be setting a timer. They have different like extensions on your computer that you can add to get up and literally look at the ceiling and bring those shoulders back and down and the arms behind you. Because just like we don't really look at each other as much anymore, rarely do we get to opportunity to look up at the ceiling. So postural breaks throughout the day. That's why the Apple Watch now says, "Hey, I think it's time for you to get up and move around a little bit." So, yeah, I suggest doing that literally like every 15 to 20 minutes, just looking up at the ceiling,
Oh,
bring the
I can't wait
shoulders
to do
back
that later.
and down. Yeah.
I will be doing that. That actually sounds like it feels nice.
Yeah.
Nice. And then, pairing that with something that like working on your mid back, the thoracic mobility, that area is so tight and restricted in a lot of people. So whether you have to use a foam roller to just work on getting extension and opening up through there, anything just to keep working on your mid back and keeping it extended instead of always being slouched forward. Okay. And then the final thing that I have to say is it's time to switch to an anti-inflammatory diet. So that's going to benefit every system of your body. And the people who are sore, who have frequent headaches or in pain more frequently, it's because of inflammation coming from what they eat. So if we don't address that, then, what's the point, right? So those are my big tips.
Love those.
Those are perfect.
Yeah, especially anti-inflammatory. It's like so many benefits. I like that.
We incorporate that into our daily lives, and we've both seen tremendous success with that. So
Especially for women, like it's great for everybody, but I feel like more so women
you get the immediate response of, so we have like a monthly reminder of how well you're doing in this area.
yeah.
Like, is it a problem or is it not a problem? And
Yeah.
so you can usually tell based on your symptoms, how are you doing well or are you doing not so well? And I can tell when I don't do well. The previous, like,
Yep.
I can see immediately. I'm like, oh, that was a
Yeah.
bit much, but I can also tell when I did good, and then I give myself a
Yeah.
little pat on the back.
Like
and I'm
women just get a
good.
few more markers. It's like it shows up in your skin, menstrual cycle. So I think it's just
Yes.
benefits us a little bit, but great for everybody.
What are some markers that men should pay attention to? Because I think that it is, to your point, easier for women sometimes to notice, but
Yeah.
men sometimes will disregard.
Yeah. So for men, some markers that men should be aware of. Well, I'll just say like be aware of your energy levels, be aware of if we're crashing in the afternoon, be aware of the quality of sleep. And no one likes to talk about this for men and women, but we have to talk about the bowel movements. These need to be moving daily, and that's how you eliminate toxins, and that's a true sign of health. And it's very rare for people to be healthy in that department when they come to see me. So that's one of the first things I have to get on track is sleep and bowel movements, essentially.
Okay.
Nice.
Perfect. Well, you know what? We like a practical recommendation.
Yeah.
All right. So perfect.
So we love to give some action items just so people can feel like they can initiate these things, like they learned something, and it's something that you can just actively get started in, moving on your health journey.
Yes.
So what do we have as our action items for
So I
today?
think our first action item was to do what Dr. Bryan suggested, which is set those reminders, set those timers, get up, look up at the ceiling, take those breaks and be mindful of those actions. And then we will let you come up with the remaining 3.
The next one I'll say is get your vitamin D checked if you haven't already. That's a great one, especially this time of year. I mean, stable vitamin D, I like it to be at around 75. Okay. So, that's going to prevent the bones from rotting away. That's going to keep you really immune strong. Okay. And another takeaway tip, I suppose, would be moving every single day. I mean, motion is lotion for those joints, and the joints literally have to move in order for them to remain healthy. It's like a piston where it pumps in and out the fluid, and that's the only way that they remain healthy is through movement. And the last thing I would say is, why are you not taking magnesium yet? Okay. I mean, seriously, all the posts on Instagram, everyone's doing it. It's time to take that before bed. The number one deficiency in this country is magnesium, and it's going to help you sleep. It's going to help with your brain function. So it's time to start experimenting with that.
Yeah, I like that.
We like the practical recommendations.
So we have our posture break. We have get your vitamin D checked. We have take your magnesium, and then what was
And keep moving. Motion
keep
is
moving,
lotion.
of course, and keep moving. And I think these are just like little easy things that everyone can implement. It's so accessible in today's day and age. Hop on Amazon, get some magnesium. Quality magnesium
supplements.
And so these are just things that everyone can do. It's absolutely accessible. It's absolutely available for everyone. So, you know, I love this. It was like very insightful, and I love that this really tied around to, holistic medicine. It's your whole body. Medicine is preventative care. I think that's like one of the most important things. If you can prevent it, do what you can to do that before, you actually have to go into sick care.
Yes, 1000%.
Perfect. Well, thank you so much for jumping on with us. I learned a lot of new things today.
Bryan, we will go ahead and tag you and make sure that you're linked so everyone can go check you out. And if you guys are local to Charlotte, make sure you guys go
schedule your appointment.
Yes, go schedule an appointment with Bryan.
Yeah, sounds good. Thank you so much, Sunday Remedy. I appreciate you, Peyton and Rachel.